Sprained ankle causes and treatment. The ankle most likely has been stretched too far or has a torn ligament if the ankle becomes swollen or painful. This can happen quite easily when the ankle unnaturally rolls inward and the foot rolls outward, an inversion injury, or when the ankle rolls outward and the foot rolls inward, an eversion injury, past the normal range of motion. The severity of the sprain depends on how severely the ligaments are stretched or torn. Sprains are divided into grades depending on this damage. Grade 1. In this most common sprain, the ligaments are overly stretched and possibly microscopically damaged, but there's not an actual tear. Grade 2. This injury is more severe, has a significant amount of ligament damage, and often involves partially torn ligaments. Grade 3. This is the most severe and indicates significant damage with ankle instability. The ligament is actually torn. Sprained ankle symptoms include a popping or snap that may be felt during the injury, pain, throbbing or tenderness, swelling, bruising, cold or numb sensation in the foot, a wobbly feeling when weight is placed on the ankle, inability to walk or weight bear, stiffness, and redness and/or warmth. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew rubber ice on your ankle to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the ankle. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your ankle with acute sinew liniments to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your ankle with chronic sinew liniments to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your ankle to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. Soak your ankle with the sinew relaxing soak to relax muscles and tendons that are in spasm, ease joint pain and stiffness, and improve range of motion. The sinew relaxing soak is particularly useful if you feel restricted mobility in your ankle. The soak is used by immersing your ankle in the soak in a pot of water. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.